so I've already sort of laid out from a leadership perspective what those dynamics are. So then the next question is, and I guess Nick was the one who said, hey, we shouldn't have a 4-year university degree anymore. And I think that's the other part to this. And so I think what we need to be doing is getting into looking at talent, as Jason just referenced, from very different areas. So what is the alternative? What are the alternatives to the classic talent we're hiring in? Now, we're still going to need doctors and nurses who have that very highly skilled medical capability. But what are the other capabilities that we need? Yeah. So one of the things we're looking at Deloitte is actually thinking about, jobs, an individual job as it's defined right now, yeah, sure, maybe that job's going to go away, but we actually believe there will still be high employment. It's just jobs will be different and they will be configured differently. In fact, a whole job isn't really going away, it's just parts of it that are going away. So from a talent perspective, then thinking about what are some of those core capabilities that cut across different areas and how do you hire them in differently? In fact, I was talking to Marwan a little bit about some research that we're doing. In this case, we're using AI for the particular research around jobs where we've broken down the ontology of the jobs, what's involved in all sorts of different jobs, and had the AI engine kind of be able to identify those and then map them over how much of those can be actually automated with robotics, how many can be outsourced, how many can be insourced but differently, all the different capabilities. And then from that, you can pull the core that you actually need to hire. So frankly, I think what this is going to mean is we need to get much more sophisticated around how we're thinking about that workforce. I mean, Jackie, you mentioned that people are asking, where's my industry headed? And that's the view that we need to take about healthcare. And just like you're looking for storytellers, maybe we are looking for the very best Zappos online, agents, because they're the ones who are going to move the patient through quickly and effectively and positively.
I think healthcare is ripe for disruption. Yeah. I like to think that we've been, as a sector, we've kind of been watchful, observing what goes on in other sectors so we can make good decisions. I'm not sure that's really true. I think a lot of physicians and nurses and leaders are so caught up in what's going on in healthcare, they haven't had a chance to look around. But I think that the consumer appetite, and I think the ability to integrate quickly, and then I think really the generational change, like we've talked about that a little bit, but for someone who's 25, their experience, so just to kind of go back, I guess, at our hospital, our parents, right, unless they've had a parent that's been ill, or unless they've been ill themselves, when they bring their child to our emergency department, they haven't really interacted with the healthcare system. So their idea of the service we provide is compared to Amazon. It's compared to Whole Foods. It's compared to, going to Best Buy, which is a really interesting dynamic because they're like, well, why am I waiting? That wouldn't happen at the Apple store. And so I think those pressures have forced us a little bit because we do recognize when your child's sick, there's nothing more important to you in the world. And we take that responsibility very seriously. And I think that's what drives and motivates us. So I think the integration will come quickly.
The part that I get worried about is, to your point, when we've done our research on the future work, and what you see is our consumers, your parents, the patients, experience a curve with technology that looks like this, that has everything on our phone, when and where we need it, talking to our house to tell us what we're going to cook, all of that stuff. So if that's the curve that we experience day to day in our normal lives, what's happening in the world of work is somewhere below it. The scary part, and I think that comes to the integration, is public policy is way down here. So the gap is massive. And so, if you think about, I go back to my engineering days, and I may get myself in trouble here because that was a long time ago, but you think about any integration working, the fundamental piece that has to be good and there and available and accurate are the data. And what I see as the challenge right now is getting that data out there and readily available so that the experience that I can have as a consumer, just the very basic experience. And let's start thinking about patients as consumers, because that's what we are. That experience requires the very basic data being available in there and so on. And that right now is stalled by public policy. So I actually think your point about we're at the golden age, I think something's going to force it, where we will have private sector things coming to play, and the government, which I do think the ministry is looking to actually be out there and do more. So my dream is that the two will come together more, and we'll see the public and private happening together to create that.